back to TV5 News at 9. It is time now for Aging in Style with McLaren. Joining us now is Trauma Program Coordinator Patricia Irwin. Thank you so much for calling in. We love it when you stop by. Thank you so much.
Hi, Colette. Thanks for having me.
Of course, you're welcome. So, Patricia, May is such an important month. It's Trauma Awareness Month. You know, with spring here, there's motorcycles, people are going out and about more, they're on their bikes, kids are doing everything. So tell us, what is trauma care and why is it so important to raise awareness, Patricia?
So trauma is really important. It's the thing to remember with trauma is that it could really be anything. It's all about the energy transfer and the forces that are applied on the body. So depending on how fast somebody is driving or how from a high height, how much they are falling, the injuries could be slim or could be major, depending on that. It's very important to remember that a large majority of traumas can be prevented by patients and people just being aware of their surroundings.
Now tell us, Patricia, what are some of the most common causes of trauma?
So the most common causes of trauma are actually not those high intense, high stress situations that everybody associates with trauma. A lot of times it's just a fall from standing.
Wow.
Especially in our elderly population, really small injuries like that equate to big problems.
Yeah, that's why we have to make sure that things are not in their way and if everything's cleared off. I know that's very important. How can these low energy events cause those major problems, Patricia?
So those low energy events cause major problems because with our elderly population, the reaction times are slowed down. And also the use of medications, chronic medical conditions really complicate and can mask traumatic injuries. If we think about a patient that stumbles on a rock, generally the reaction time would just be a stumble and continue walking. Sometimes with our elderly patients, what can happen is they stumble on a rock, but their reaction isn't as quick, so it turns into a trip and fall. Sometimes that could be a bruise or some hurt pride. Other times it could be a broken bone or even bleeding on the brain.
Wow, that's so interesting. A lot of people don't know about those low energy trauma. I want you to also talk about, we need to know the steps. What can we do to prevent injury? That's very important.
Yes, so for the ground level falls, there's some simple things that everybody can do around their home. That is where most of the falls occur. So simply removing rugs from the floors, keeping their walkways clear of clutter, well-lit stairways, and even the use of night lights at home during the evening hours really helps light those pathways so people can see where they're going.
Sure, and we know a lot of people are delaying care, delaying going to the doctor even for a checkup because of the pandemic. So do you have advice for people who have been injured but are delaying care because of the pandemic?
You know, COVID-19 can be scary, and it's scary talking about it, but really, if you are injured and you are hurt, please do not delay seeking treatment. A lot of concerns and complications can happen if you are injured and you delay that care. Everybody here is making sure we're using full PPE, a lot of frequent hand washing, and it's really best to come seek care when you need it.
Sure, and every second counts, as they say. Thank you so much.
Yes, it does.
Thank you for stopping by for this valuable information. We appreciate it, Patricia.
Thank you for having me.
Of course, you're welcome. If you'd like any more information, just head on over to the Aging in Style page. That's at WNEM.com.